This is a video on the examination maneuver for midcarpal instability. We have no relevant disclosures. Midcarpal instability is a type of non-dissociative instability between the proximal and distal carpal rows, and it's a collection of multiple distinct entities resulting in abnormal midcarpal mechanics when various intrinsic or extrinsic ligaments are injured. There are multiple critical volar side ligaments, including the palmar arcuate ligament, which is comprised of the scaphocapitate and triquetral-hamate capitate ligament, as well as the scaphotrapezial trapezoid ligaments, the RSC and the long radial lunate. Dorsally, the dorsal radiocarpal ligament and the dorsal intercarpal ligament are implicated. Here on the volar model of our hand, we can appreciate in light blue the arcuate ligament components and the SCT ligaments in dark blue. In pink is the radioscaphocapitate ligament, and the long radial lunate ligament is in purple. Looking at the dorsal side of the wrist, we can identify the dorsal radiocarpal ligament, which is in light blue, and the dorsal intercarpal ligament in dark blue. Moving on to the examination maneuver, this is best performed when the patient's hand is in pronation. I will be demonstrating it in the neutral position, however, just to demonstrate the midcarpal joint subluxation. I'm putting a palmally directed force onto the capitate, which is just at the base of the fourth metacarpal, and you can see here we're subluxating the midcarpal joint. And then with some ulnar deviation, as the wrist is ulnarly deviated, the triquetral-hamate joint is engaged, which causes forceful extension of the proximal row and reduction of the carpal joint. The test is positive if this clunk with ulnar deviation is associated with pain. This is otherwise known as the catch-up clunk, as demonstrated here.